Hi everyone, and welcome to ATP Live Monday. Happy International Women's Day to all the women all over the world. And for those who are watching me, welcome to ATP Live. I can see my colleague joining me. Yeah. So welcome to everyone. I'm just going to quickly set up the one for the our Facebook group, then we are good to start. Hi, I'm Lara.
Good evening, ma.
How are you?
I'm fine, ma. How are
Love.
you, ma?
I'm great. Happy International Women's Day to you.
I wish you the same, ma. We celebrate you.
Uh, so let me just quickly set up for the ATP people on Facebook so that we can get started. Foundation. Okay, so welcome. You can welcome the people joining us for our session. Okay, sorry.
Okay, good evening, everybody. So, we welcome you to today's episode of ATP Live, and I will be hosting our CEO, Dr. Gbemisola Boyede. Today, we celebrate every woman on ATP. We know you are strong people, and we know you are ready to challenge. Even we as ATP has choose to challenge the preventable deaths of children rooted and ignorance in the whole world. So we are challenging every one of you today as well to choose something to challenge. Do something to make this world as a woman a better place. So this evening, if you have a question, you can drop your question on the comment section. And please don't worry, we are going to answer every question. But ensure when you are pasting your question, let us know your child date of birth, the current weight, and death weight, so that we'll be able to answer every question relating to weight and
Okay, so
so
I think I put the wrong one. Let me just quickly. I think I put the wrong video.
oh, okay, ma'am. I thought I lost you.
Yeah. Okay, just a minute.
Okay. Welcome. I can see some people joining us.
Yeah.
Pretty Mary Good, you're welcome. Miss Evans, you're welcome.
Okay, can't seem to.
Faisha, you're welcome. Tima Odu, Naomi, nice to see you. You're welcome. That's ATP and ATP volunteer. Olori Emas, you're welcome. Nikki, thank you for joining us.
Okay.
And Bobby Grace, thanks for joining us. Please stay online and ensure if you have a question, just drop your question and comment section. Why has will be answering every child related question. And please don't forget to follow us on Facebook and at the Pediatrician Foundations, and also on our family page at the Pediatrician Foundation family page. Likewise on Instagram at the Pediatrician, and also on YouTube. You can go on YouTube and watch every of our previous lives. All our previous lives are there. And let me tell you, if you have any question and don't want to wait for long, just go on your app store and download Ask the Pediatrician apps. On the apps, you can ask as many questions as possible in child relating questions. I want to tell you how your answers are there. Please feel free to download our apps as well. Thank you for joining us, Woyo Sore, Nikki D. Good to have you here. Okay, we have some questions rolling in already. Wow, that's so fast.
Yeah, just a minute.
Okay.
I don't know. I'm having difficulty putting it on the group, but I'll soon be ready in a few. Okay, I think I'm done now. Okay. All right.
Okay, okay,
It
all
just seems
right.
not to be showing.
So, um, We'll be starting. Just give us a moment. We're going
Just
to be
give us
starting.
2 minutes just to put it up on the group for those who usually don't join the page so that they can say, okay, good. I think
So,
I'm
okay, all right. So
just,
talking about International Women's Day, ATP worldwide, the woman is our CEO. So I can tell you that what a man can do, a woman can do better. And the ATP worldwide, we have done so much, and we are still doing. We are just starting both offline and online. Are you ready, ma'am?
yeah, I'm ready now.
Oh, okay. So join me as we welcome our CEO to today's live. Dr. Gbemisola Boyede.
Hi, everyone. Sorry for the break. I was just trying to set up the set up all our Facebook groups so that people can watch it on the watch party. So we are ready to start now. Yeah, okay, I think I'm done. Okay. It just took me a few yeah. All right. So just one more second. Technology. Okay, good. All right, so we can start to take our questions. But before we start, I just want to welcome everyone to this ATP Live, and especially to wish all the women that are watching Happy International Women's Day. At Axi Pediatricians Foundation, we are a foundation full of amazing women. I think like 75% of our members on the Facebook group are women, and I would say 90% of our volunteers are women. And then, of course, so we have lots of amazing women who are doing amazing stuff on our Facebook group, on our foundation, touching lives. So I want to wish all these amazing women a happy International Women's Day. And especially we in today's this year's theme is about challenge, choose to challenge. And in ATP, we have chosen to challenge the preventable deaths of children in Nigeria, in Africa, and in fact globally. And that is what we do. And we are looking forward to that day when no single child will die as a result of preventable cause of death. And this is why we do what we do, including what we are going to do now, which is to answer all your questions, because information is so important to make sure that we don't end up, most of our children, especially in Africa, majority of the deaths are things that we can treat, are things that we can prevent. But because of ignorance, because of lack of access to appropriate information, a lot of children are still dying. And this is one of the things we are challenging in ATP. And we're doing it online through our social media platform, and we're also doing it offline through our community outreaches. So if you are one of the amazing women and you want to challenge along with us, you are welcome to join us. You can volunteer, you can donate. There are many ways you can support ATP, or you can just learn and also tell other women some of this information. I'm very excited for some of you. I do see all your comments. I see all of you telling people on Instagram where people are giving wrong information, like, no, don't take that information, go and ask pediatrician. Thank you so much. I can see all the tags. Please keep sharing those kind of information, and let's us together challenge the deaths of our children, and that no child should die anymore from preventable causes of death. So welcome to ATP Live. So we'll start to answer your question. You can ask on Facebook, you can ask on YouTube, you can ask on Instagram, and we're going to try and do as much as we can in the next 1 hour. So Malara, I think you can go ahead now and start reading out the
So,
questions.
okay. We have a question from Nikki B. Good evening, doctor. Please, can I take pics of my son face? Whether it's it, what can I do, ma?
Sorry, can you?
Yeah. She said, please, can I send pics of my son's face? Nikki B, please, you can post your son's picture on our group page, ATP Facebook page. You can
That,
send picture to our ATP Facebook page. It will be easy to access your child's face there.
yes, it's easier than to put it on our. You can easily do that on on a on a live program. It's better if you put it on our Facebook group, and then we can answer. Just for you to know that Ask Pediatricians Facebook group, we answer your questions 24/7. 24/6. Usually we don't answer questions on Sundays. So feel free to post your question, and one of our moderators will be there to answer the question. Yeah. Amalara, am I losing you? Okay.
I think we lost her. Okay. Hello, Dr. Baby.
I'm here.
Oh, okay, ma'am. That's the only question that we have right now. Do we have anyone on Facebook?
Okay, let me go to the watch. Let me go to use Facebook. We have a lot of people on Facebook already. Thank you so much for everyone for joining us. Let me just put the Happy International Women's Day there so I don't forget. Okay, thank you. Good evening. Good evening, Akin Moye. Good evening, Princess. Good evening, Zachariah. Good evening, Priscilla. Good evening, Amaka. Good evening, Lavina. Okay, so the first question is, please, Ma, is it advisable to inject a child on the lap? So I guess this question is about whether you can give intramuscular injection on the thigh, and that is actually what we recommend. We number one, as much as possible, we don't want children taking intramuscular injections. As much as possible, we prefer children to take oral drugs. We prefer them to take it as tablet or syrup or by mouth. But if there are some instances where we have to give injections, if, for example, a child who is vomiting and all that. So if a child is vomiting and the child needs to take medication, we prefer it is given into the vein, not as injection into the muscle, because children don't really have that big muscle like adults and all that. But if we have no choice than to give it into the muscle, for example, things like some immunization, for example, or there are some drugs that maybe we just have to give it, or it was difficult to get the vein or things like that, then it's preferably give it into the lap, into a big muscle group. We try to avoid the buttocks, where traditionally most of our nurses try to give injections. The reason is that there's a particular nerve, we call it the sciatic nerve, that runs through that place. And sometimes in some people, it can run haphazardly. So if a nurse should inject the child on the buttocks and hits that sciatic nerve, that child can lose the ability to walk. And so you see children saying after injection they can't walk again, and sometimes the recovery may be a little bit difficult. So it's better to avoid places where the injection can hit the nerves. So that is why the muscles on the thigh are better. So it's better to give it on the thigh rather than on the buttocks. But as much as possible, we don't even want injections at all. And some of you like going to the hospital and claiming, oh, I prefer injection, I prefer injection. Injection is not better, it's not faster, it's actually more dangerous. So if your child is not vomiting and your child can take the drugs by mouth, it is better to give the drugs by mouth. But if your child, for one reason or the other, needs to take injection, then preferably give it on the thigh. I hope that is helpful. All right. Thank you, Rose, for joining us. Chineye, thank you so much for joining us. Okay. Christiana is asking, glad to be here. Happy International Days to us. To the ATP team, I celebrate you guys. Thank you, Christiana, for celebrating us. Princess is asking, please, ma, my son of 2 years and 2 months has been vomiting since yesterday. Wow. But no point, just vomiting. What should I do? So usually for vomiting, you have to go to the hospital. A child who is vomiting, we don't have like any first aid for you to stop the vomiting at home. People have this question all the time. Please don't go give the children Phenegan or all those kind of things people give. They are very dangerous drugs to give. So if your child is vomiting, you can try and give some ORS just to replace what the child is using. But if the child is also vomiting that and the child is not keeping anything at all down, then that is a reason for you to take that child to the hospital. And because we need to know, number one, why the child vomiting. Number two, we need to replace what the child is doing, losing. And if a child is vomiting and losing fluid, there's no only way we can replace it to give it through the vein. And so that is why vomiting, most of the time, if it's just one or two episodes and you stop and the child is now taking all that, and then that's fine. But if the child keeps vomiting everything you give, then you have to make your way to the hospital. Unfortunately, there's nothing else you can do at home. Thank you, Princess. Say good evening, Doctor. Trust you're fine. God bless for all you do. I celebrate you. I celebrate you too, Princess. Happy International Women's Day to us all. Thank you. Okay, Christiana is saying, hi doctor. So the nurses gave me a wrong date for our 14-week immunization. I noticed the error when I got there, but just be on the safe side. And they said she can't take it again because she's already 16 weeks. I don't know if that is something to worry about. No, that is wrong information. So if your child mixed immunization, the child can still take that immunization. I even thought that maybe they gave you an earlier date. That's even when you now say come back on the right day. But if your child missed immunization and you go on a later date, that child still needs to take that immunization. We call it catch up immunization. So that information given to you by the nurse is completely false. So you need to go there and you need to take that immunization. Your baby can still take the immunization of 14 weeks at 16 weeks. In fact, if your child has never taken immunization ever in their life, they can still be given the immunization as whenever you are ready for them. We can still give the child the immunization. So it is wrong to say the child cannot take immunization. There are a few exceptions. The only exception is rotavirus. For example, after 8 months, you can't take rotavirus again, and it's not something to worry about. Reason because rotavirus tends to affect children between the age of 6 months to 11 months. So taking it late is just really not necessary because the what we're trying to avoid would have already happened or it has come to pass. So there's really no reason. But any other vaccine, your BCG, your DP, Penta, and all those vaccines, even if we pick your child at 5 years, we are still going to give the child that immunization because the child is still at risk of having those infections, and they are killer diseases. They are diseases that can kill children. So we don't joke with them at all. So a child who miss immunization at 14 weeks should take it at 16 weeks. So that is still not too far away. And now you say my daughter is 9 months now, so that means you've wasted so much time. But no problem. If at 9 months, your baby can still take your 14 weeks immunization because, and your baby can take it at the same day as your 9 months immunization because they are not the same vaccines. They are different vaccines. So your child can say, I know some people are always scared that oh, that means we're giving too many vaccines. If you are worried, you can take one day and come back maybe another 1 week and take the rest. But you can actually take all of them the same day. It doesn't really affect your child. So that's very important. It's important that you go back for those immunization. This is what we call missed opportunities. So you've been to the hospital, your child needs immunization, and they didn't give because of wrong information. We call it missed opportunity. Yeah, sorry about that, but you really need to go back and go and take that immunization. I wish you have asked us a long time before now, but no problem. You can still go and get them. Okay, so your baby is 9 months, the weight is 8.5. That's not bad. We're still okay. She had high temperature and was sick at 7 months. She lost. Okay, we've answered your question. Don't worry, we always answer your question. So your baby's weight is still okay. Usually the average weight at 9 months is 9 kilos, but it can be a little bit less. It can be a little bit above. As long as it's still within that average, we are happy with it. So there's no reason for you to worry. Thank you so much for joining us. Okay. Ineka is asking, my son prefers only swallow. It is so strange. There's something strange about it. I think I've tried different foods, even baby milk. No way, it'll be 1 year in 3 weeks' time. Should I worry about that? So there's something wrong with your baby eating adult food or what you people will call adult food. So the most important is that the child eats and the child eats different food. And at 1 year, your child should be eating everything you are eating. And of course, your baby needs to take milk, but it doesn't have to be baby milk. Your baby can take the regular milk from age of 1 year. Your baby can take the same milk you take, or you can buy any of the follow-up milk that is from the age of 1 year to 2 years. That's what you should take, or 3 years, depending on the range of how the one you find. But you can even buy the normal milk that you take. So the most important thing is that your child eats and eats variety of food. And I always say, from 6 months, children can eat everything like you are also eating. It does that from the when you are just starting, it has to be semi-solid, it has to be mashed, it has to be puree. But by the time they are getting to 1 year, it should be like your normal what you also eat from your pot, the rice, the yam, the swallow, everything. Most important thing is that you're making sure that the baby has all the different classes of food they are represented. So your carbohydrate, your protein, your fats and oil, your vegetables, your fruits, that will supply vitamins and minerals are also there. Of course, your dairy product. The most important thing is that you have a good combination of all of them. So this is the most important. So whether I get a lot of questions where mother think some food are baby food, like some of the things they buy in the shops, and they worry that maybe their children are not eating some of those ones that they buy in the shops. If your child is eating what you are cooking in your kitchen, that's even actually preferable than your child eating what you're buying in the store. So there's really no reason for you to worry about that. So I hope Ineka we have answered your question. Okay. Okay. Christina say
Can I add this to Ineka, ma'am? She can join our nutrition course on complementary feeding. That will give her all the answers that she needs about her child food and nutrition.
yeah, thank you, Amalara. So yes, Christina says, can you volunteer? Yes, you can volunteer on ATP. You can volunteer many ways. You can volunteer. So you
Yeah.
can send us. If you send us an email, we'll send you our link to volunteer. So we always welcome people who are happy to volunteer for our group. So you're welcome to reach out to us. Send us an inbox to one of the admin who will respond to that. Okay, Zainab, thank you. Say good evening, ma. It's good to have you do what you do tirelessly. God bless you awesomely. Thank you. God bless you too. God bless all our team members. Chiamaka say good evening. My son of 3 months have different skin color on the neck, like the neck area is lighter than the other skin. Some people say it's in ray. Okay, I've not heard of in ray, or is it in la or in ra that you want to say? Please, what can I use to clear it? Okay, so basically what I can deduct from that question is that your baby has skin rashes. There are different type of skin rashes. So some skin rashes are due to allergies. Some skin rashes are due to infection, like bacteria or fungal infection. So there are different kind of skin rashes, and there are different causes. Most people are fond of just giving a generic name, like Yoruba people will say La, some people will say Nla, some people will say Nra, all those kind of names. And but it is not that is not how it is in medicine. So in medicine you have different kind of rashes caused by different things, and that is why you will try what they tell you to try. You don't work because the cause of the rash will determine the treatment for the rash. So if you are giving the wrong, if for example if your child has a fungal infection and you are using antibacterial cream, it's not going to go away. Or your child has an infection and you are using steroid cream, you're actually going to worsen it. So it is better to have a doctor see your child, make a correct diagnosis, and treat the child. That's the best thing to do. Otherwise, you will just be. And sometimes some of the treatment we do, all the trial and error treatment we do, sometimes we actually worsen. That we will actually make things worse. So it's better not to do that. It's better to have a proper assessment, a proper diagnosis. There are many questions doctors will ask you. We will examine the baby, and that will help us to know what is causing the rash, and that will help us to know the treatment that you should use. So it is very, very important that you get it right from the beginning. How that is helpful. Yeah. Okay. So Lavina is saying my baby's temperature. We'll also come back to Instagram. Let me just quickly take the remaining two
Okay,
questions on
ma'am.
Facebook, and we'll come back to Instagram. So Lavina
Okay,
is
ma'am.
saying my baby's temperature is between 36.9 to 37.4. Hope it is normal. No, that is normal temperature. It is not bad. Normal temperature is usually 36.5 to 37.4 thereabouts. It's going above 37.5. Then we talk about fever. So anything above 37.5, that will be fever, though it can be mild fever. But once it's going above 38, 39, then we're talking about high fever. So that's fine. Okay, Christina, thank you. Hope is saying my baby of 3 weeks hiccups. Should I worry? No, you don't have to worry. Hiccups is one of those common things baby do, and it will stop on its own. You don't need to do anything. You don't need to put a white cloth on the head. And you can breastfeed if you want to, but it doesn't really do anything. But it will stop on its own. And again, to someone that underwent CS after 3 weeks, now take tea. There's no reason why you can't take tea, whether you have CS or not. If you want to take tea, you are welcome to take your tea. So just follow whatever your doctor tell you as regards to serious situation. Please don't listen to people telling you don't do this, don't do that. The only person who can tell you what you can do or what you cannot do is the doctor who operated you. And usually for cesarean section, there's really no special food. There's no special anything. You can eat normal food, and there's no special food for a nursing mother or a breastfeeding mother. You eat normal food, drink your normal water, drink your normal tea. The most important thing is that if you eat something and your baby is a little bit if your baby start becoming fussy, or your baby have right, you may want to watch, maybe your baby is reacting because some babies are allergic to some of the food you eat. So you may need to watch that. Otherwise, there's really no rules regulation of don't eat this, don't drink this, don't drink that. There's nothing
They are
like
all pure meat.
yeah, so you can take your tea. It doesn't have any issues. All right, Ire Kindness is saying, is it good to store a baby's feeding bottle in milk tea added to water? Okay, so let's address the issue of feeding bottles. Number one, pediatrician generally we don't like bottles. We don't. Because it is very difficult to clean, and it can store, it tends to it's make especially those mouth, those teeth, that part of it is very difficult to clean, and bacteria germs can easily lodge inside and they can multiply, and then the baby is predisposed to having infection, diarrhea and all that. So we don't like bottles. We prefer use cup and spoon because it's easier to clean. There's no small part, no teeth and all that. But I know some others really struggle with because of how busy you guys are women. So what if you were going to use bottles, then you have to make effort to wash it and sterilize it properly. And what I normally tell about that is better you do it once a day. In other words, so when you need to have like multiple bottles. If you are going to use bottles, you have multiple bottles, so that when you use one bottle, you just leave it. You don't reuse that bottle again,
Yes.
because you need to sterilize it for 24 hours. So there are two different ways of sterilization. There are many ways of sterilization. You can do cold sterilization, you can do hot sterilization. These days, because of many of us have this microwave now, so that you can do steam sterilization is very easy. So there are sterilizers that are like steam based. So
Sterilizers.
yeah, so once you put the bottles inside, you put inside your microwave,
Just
it
on.
will convert it into steam and sterilize your bottle. So what you just need to do, just pick one bottle, use it. When you finish using that bottle, rinse it off and leave it for when you will wash everything, maybe at night when your baby is sleeping, you wash everything at once, and then you sterilize them
Sterilize.
again. So instead of what most mothers do, we say they will sterilize, but then they will use one bottle and reuse that bottle. When once you use the bottle, the sterilization is lost. It's lost. And it's also again why we say don't store leftover milk. Any milk that is not used, you throw it away or you drink it. These are the ways, because people do say, oh, I'm sterilizing, but you are sterilizing, but you are breaking those sterilization protocol along the way. And then you will see whatever your baby is having diarrhea and all that. So you use one bottle once, you don't reuse it until you wash it and sterilize it all over again. And it may be cumbersome to be doing sterilization every second. So it's better you use several bottles in a day and wash all at once, sterilize all at once, and that's it. So you will hardly use more than 6 or 8 bottles in one day. Then two, if you want to use cold sterilization, then use the melting one. So maybe you put about 5 liters of water and then 1 tablet of melting, and then you put all your bottles that you have washed thoroughly, rinse thoroughly, and then you put it in the water. And again, the same process apply. Only one bottle at once for the rest of. Then you use different bottles for the rest of the day. And before you use it, you wash your hands and all that. So, but if you can avoid it, don't use bottles. So if you exclusively breastfeed, for example, you won't need bottles. And when you finish your exclusive breastfeeding, you go on to complementary feeding. And please don't give complementary feeding via bottles. Complementary feeding must be given via cup and spoon. Because they are porridge, they are not supposed to be passing through bottles at all. So please don't use bottles for that. So, and when your baby needs to
Oh,
drink
okay, ma.
water, use sippy cups and all that. Yeah.
Okay, ma. Please, can I ask a question for the sake of some of our mothers here? You have talked much, expanded more on feeding bottle. Okay, for the sake of those children that doesn't suck directly, we have some kids like that. They refuse to suck, and now pediatrician doesn't support breastfeeding. What do you have to tell them about maybe spoon feeding? Is it
Yes.
safe?
Yes. So the option we prefer, even if your baby is not going to suck, or your baby may even be sucking, but you are going to go out and somebody else needs to feed your baby, is to use cup feeding or spoon feeding. It's very simple to do. You just carry your baby, prop up, and then just put the sip of the cup. If you don't know how to do it, the nurses can demonstrate it to you. They can show you how to do it. We have our breastfeeding videos. If you watch the breastfeeding videos, they also show you how to do it there. So you prop up the baby and just put the cup the same way you put the cup in your own mouth. It's just that this time around is going to be slight tipping. You're not just going to pour everything down their throats in 1 minute. You're going to be tipping it a little bit. And it's just a matter of time. Once you start practicing, you find that the babies do it. Even for our preterm babies, our babies that are preterm, that's how we feed them in the hospital. So, and they drink it nicely. So, even not talk of your big babies at home. So, you can feed them with a cup, or you can do a spoon at a time. I know most of you will complain it takes time, but if you also practice it and you get a hang of it, it's very easy. But you see, the most important thing is the safety of the child. We don't want the child to have diarrhea, infection, and this milk food is the easiest way for the children to have all these infections. So you need to really avoid that. So I hope that is helpful.
Thank
So
you, ma'am.
let's go back to
Yes.
Facebook. I mean to Instagram. Then we'll continue from
To
there.
Instagram. Okay. Lovina has a question. She said, please, doctor, my baby temperature is usually 36.9 to 37. I think you have already answered that.
Yes, we've
Um,
answered that.
yes. Okay, so we go on to Precious. She said, please, doctor, what's the cause of constant sneezing on a 1-year-old after having done surgery for adenoids?
Okay, we 1 year old has done surgery for adenoids and is still sneezing. The question I want to ask is, what are you giving? Are you giving anything? Are you applying anything? Some of you like to use this silver bed oil on the head of the children and all that. It can make them to sneeze a lot. Or there's something your child is allergic to in the house. Because sneezing is a form of irritation. Something is irritating the child, and the child is sneezing to get rid of it. So sneezing itself is not the problem. The problem is that why is the child sneezing? Is the child reacting to something, and how do we get rid of that? So usually so check the house. Make sure you are not fleeting the house. Make sure you are not using mosquito coils. Make sure your generator is not close to the you're not close to the rooms at all, or the bedroom where children are sleeping. Make sure you're not the kitchen, you're not frying oil, frying pepper, all those things. Perfumes. Some of us we use some of these things, we don't even think about it, but it can, if somebody is allergic to them, then it can cause them to sneeze a lot. So you really need to think carefully, walk through your house carefully. What are the fumes? What are those things that your baby is like? Even dust. Even some of those things, some children are allergic to them. So for such children, we say don't use rugs. You don't use drugs, you use tiles in your house so that it is easy to mop it without generating dust. Some of you have pets, your dogs, your cats. Some children are allergic to them, and it make them to sneeze when they come in contact with them. Grasses, if you live in those maybe in an area that is newly developing and there's a lot of grass, a lot of those are the kind of things that children can be allergic to. So there are thousands of stuff, So you really need to think through what is it, but it's a sign of a child who may have what we call allergic rhinitis. So, but the most important is that what is child allergic to? How do we get rid of it? Sometimes we don't even know what it is, and what we just have to do now is to what do we do now is to um we just give the children some drugs, some anti allergic medication. Sometimes as the way the asthmatic people use the inhalers. We also have the one to spray for
Inhaler.
the nose. Yes, that is also for those who have allergic rhinitis as well. So those are some of the things that you can do. Yeah.
So, in other words, you have to pay attention to your environment as well. That is
Yeah.
important. So, and who also is asking, good evening, doctor. Good evening, Anu. My 13-month-old son just started his habit of beating his head with activities and repeatedly as a form of playing.
How old is the child?
13 months old.
Okay, like I said, it could just be an habit thing. So sometimes we don't worry too much about some of those kind of things. So I will just watch it for now. You can. So what I normally say for children when children have habits is that you distract them, give them something alternatively. So instead of the child eating his, why not give him a toy or something he can be eating or playing with, and that will avoid him using the hand on the head. So sometimes those kind of habits is a matter of days or weeks, or sometimes it may be longer, but they will tend to go away as long as there are no other developmental issues, because sometimes children who have some of these habits also have developmental conditions. Maybe if they will see other signs too. Maybe they are slow walking, slow talking, slow. So in that case, you need to see a developmental application. But if it's just that habit isolated, the child is otherwise well, the child is otherwise fine, then I will not worry about that.
Yeah, thank you. I was laughing when you said just give your child a toy. Don't go and give your child a hard toy to eat in his head, though.
Yeah, you need to give appropriate toys for appropriate
Toy.
age group. So most of you, when you are buying toys, they will always write it's suitable for children below, not suitable for children below 3 years. So please, those advisory are important. Most parents don't read it. They just think we are just those who are writing it are just writing. No, it's very important. Usually for children below the age of 3, don't give them toys that have small parts. Don't give them toys that have part of it that can come out, because they can swallow them. And I've seen parents asking us this kind of questions before. So please, it's very, very important. So most of those kind of children, they need soft toy. Just one simple soft toy that they can just play with, like some of these soft books and all those kind of things. But don't give them complex kind of toy that have small part that can be coming apart, and some of them, because they will end up putting it in their mouth. So you have to be very, very conscious of that. So please, it's very
Thank
important.
you, ma'am. So, Ugona Hazy, at what age will you get worried if a child cannot make using multiple words together? Like, at what stage you like get worried if a child cannot make a full sentence?
3 years old. If a 3 year old is not making sentence, I'll be worried. If a 2 year old is not combining two words together, I will be worried. If a 1 year old does not have any word at all, I will be worried. So I usually say, remember the rule of the thumb: 1, 2, 3. A 1 year old should be saying single words. It may just be one word, it may be 1 to 3 words, but it's 1 year old should have at least 1 to 3 single words. A 2 year old should have at least two words they are combining together. Mommy go, mommy biscuit, that kind of thing, phrases. A 3 year old should be saying 3 word sentences. I want car, I want this, mommy, those kind of questions. A 4 year old should be talking like an adult. A 4 year old should be able to talk to a stranger, and a stranger should have no difficulty understanding what a 4 year old is saying. So those are the rule of the thumb. So if you are worried about any of those rule of the thumb, then it's best to see a speech therapist first, and then the speech therapist can now recommend for you to see a pediatrician if we need to see them. Yeah. Amalara, are you still with me? Amalara? I think I've lost Amalara. Okay, while I'm waiting for Amalara to come back, let me go back to Facebook and answer a few questions. Okay. Oh, you're back.
Thought was hello, ma'am.
Hello, Amalara, you were off a bit,
Okay.
so you just restart your question now, because I
So
was.
Philomena has, yes, Philomena has my baby saying that it can cause some minors, but apparently the doctor said it was due to an infection, which is as 14,000. I don't know what she means by
That's the
14,000.
white blood cells, I guess she's saying. Yeah.
Oh, okay. Okay. My only challenge now is that he seems to be allergic to medication or something else. He has some reaction on his face. Now we are trying to clear.
Yeah, so just wait for it to clear. If the child is allergic to any medication, the solution is to let your doctor know. Your doctor can stop that medication. Your doctor can give alternative medication, and the rashes will clear once you stop whatever it is the child is allergic to. So there's really no reason to worry. But just be sure it's not something else, because it's not every rash that is an allergic rash. So the way you know it's an allergic rash is that when you stop whatever it is you think the child is allergic to, the rashes should clear. But if it is not clearing, it could be a rash on its own and nothing to do with allergies at all. But I'm happy you're seeing a doctor already, so I'm sure they will sort that out for you.
Ugonna Eze, my 4-year-old doesn't like taking fresh milk again. Is yogurt healthy option that can give him same nutrients as milk?
What do you mean by fresh milk? So is it like liquid milk, or is it, because I'm sure most Nigerians don't give fresh milk? So do you mean powder milk, or do you mean when you make milk as a drink? So there are many ways to give milk to children, because children below the age of 5 still need milk. So you got to see, okay, you got to see a form of dairy products and all that, you can give that, but you can also give milk. You can give it as smoothies in food. You can mix it into food. You can make it part of your cooking. When you're cooking, you could already add your milk into it. So there are many ways to do it. So I'm not really sure. It doesn't have to be fresh milk as long as it's milk. So that, I think that, unless what you meant by fresh milk is liquid milk, then you really need to clarify that. So just to be sure.
Okay. We still have more questions here. Can I go on, or you want to check on Facebook?
Let's just take a few more on Facebook so that we don't pile it up. Okay, I think no,
Okay.
there are not many on Facebook, so I'll quickly round it up. Okay, so Princess is asking what malaria drug is best for a year and 2 months old, and what between paracetamol and ibuprofen which is best for fever. Now, number one, there is no best malaria drug for any particular age group. We have malaria drugs, and we have different type of malaria drugs, but what is recommended for those of us in Nigeria is to use what we call artemisinin combination therapy, ACT anti-malaria. So we have different type of the ACT anti-malaria. You have the Coartem, and so the principle is that there's one drug that is a artemisinin drug, and there's another drug, another anti-malaria. So it's a combination therapy. So if you go to any of the pharmacy, they will tell you, some of them already come pre-packed for different age groups, so they'll be able to give to you. But let me just sign a note of caution that please don't just treat your children for malaria once they have fever, or don't just treat them for malaria every 3 months like some people do. So please don't do that. So let the malaria be confirmed by a blood test. So there are different type of malaria tests. We have what we call the rapid test that, and most hospitals can do it. So they do it because some of the time we just treat them for malaria. Malaria is not the only thing that will make children to have fever. And that, I think I want Nigerians to understand this, and I think it's because of the way we normally call it. We call it malaria fever. So people now think that fever is a short form of saying malaria fever. No, fever just means your child's body is hot. Your child's body is hot. There are so many things that can make your child's body to be hot. Some children are even hot because they've been playing in the sun, or you have dressed them too tight, maybe when the weather is hot. And all you need to do is to remove those clothes, the fever goes down. Some children are hot from dehydration, they've not drank enough water. So it is not every time the body is hot that it is malaria. So, but if for example you think your child is hot, you've given them water, you've removed the clothes, you bath for them, and the temperature continues, and then you think, okay, there's something else going on here. So it could be malaria, yes, but it could be other things. Sometimes you don't have infections. For example, if your child is coughing along with the fever, it is most likely a chest infection than malaria. Or if the child is having a hair discharge or some other things, and or the child is having rashes. So there are other causes. So everything is not malaria, malaria, malaria. Because people sometimes will be asking questions like, my child has fever and I've treated malaria and the fever has not gone. And they were like surprised, like, why has the fever still not gone? And I always like, I'm also surprised that you're asking, because malaria is not the only thing that can cause fever. There are like 1,001 things that can cause fever in children, from minor issues to very serious issues, even like cancer. So don't just assume every fever is malaria. So if your child is having fever, for do normal thing, remove their clothes, give them a cool bath, You can give paracetamol. There's nothing that is better between paracetamol and ibuprofen. They are both drugs that you can use. But usually, as a pediatrician, I normally recommend use paracetamol for mothers because for example, ibuprofen must be given in a child who has eaten, because it's what we call non-steroidal anti-inflammatory drugs, which means when you use it on an empty stomach, your child can have, it can give them like ulcer kind of symptoms, what we call gastritis and all that. So it is not, so it is really a little bit, it can, and most children when they are sick, they are not eating well. So it's a little bit technical using ibuprofen, but paracetamol is safe even if you give it on an empty stomach. So I prefer mothers use paracetamol and let the doctor be the one giving ibuprofen when we think we need to give it, because the child has to be eating when you are giving ibuprofen rather than but paracetamol they don't need to eat. So that's the most important thing, and you must have those ones at home. Give it if after 24 hours your child's fever is still continuing despite your paracetamol. And when you're giving paracetamol, you have to give it every 6 hours, and you'll be checking the temperature as well with your thermometer. So if after doing all that your child is still having fever, please take to the hospital. Don't assume malaria. Take to the hospital and let the doctor treat your child. Let them do tests. Some of them will do blood tests. They will examine the baby. They don't need to do blood tests all the time, but they can examine the child. Check the chest, check the ears, check the throat to know where the fever is coming from and treat appropriately. And some of you, please don't be going to do blood tests by yourself without seeing your doctor, because they will, every time it's malaria and typhoid. Everything is not malaria and typhoid. It's really the Gaussians. Everything is malaria and typhoid. Please, it's not. So please see the doctors. Let them examine your child. If you think money is an issue, most of our government hospitals, they will at least examine you. They will still write the drugs for you without taking money, especially for children. So at least they will do that first, then they can now have you to go and buy the drugs. So at least you have seen the doctor before you go and buy the drug. So it's very, very important. I hope that is helpful. Okay, Peace Peter saying, my child is 2 years old. She's not yet to talk. He can say some words. So if a child is saying some words, then you can't say the child is also not yet to talk, because sometimes mothers say these things uh, innocently, but you are confusing the doctor. So if a child can say some words, and that child is, you can't say that child is not yet talking. If the child is saying only 2 words, only 3 words, just tell us the child can only say 2 words. That's more, it's more useful than saying the child is not talking, but the child can say some words. So we are kind of confused. Which one is it now? so um so a 2 year old, like I said, should be combining words together. So your 2 year, you didn't really tell us how many words your child can say, or are you saying your child is saying things like babbling, but you can't make out the meaning? So if your child does not have any recognizable word, that the child is not saying mommy, daddy, or saying ball, or a few single words, then I will worry about that child. And like I said, you need to see a speech therapist. It may not necessarily be that there's something wrong. Some children are a little bit slower, in terms of development. But I always tell mother it's better to see a doctor or speech therapist where we will support your child, and then we'll tell you your child is catching up, rather than for you to waste time that we could have used to stimulate the child's development. So it's better to see the professional first so that you can get the right support on time. So there are many reasons why a child may not be taught. Maybe that child is a little bit slower. Some of us are slower than the others, but it may also be the child may have other developmental issues that a professional needs to identify, and we need to support your child with. So it's better to see a speech therapist. Okay, so Princess is saying my child of 2 years temperature is at 7.4. That's the normal temperature. Oh, we're not the one. Yes, we're the one asking about paracetamol, anti-malaria. Now, the temperature you are even giving is a normal temperature. So your child doesn't even have fever. So your child doesn't need to be treated. So I always tell parents, I always tell mothers especially, that your hand is not a thermometer, is not an instrument. There's a reason why we have to develop an instrument called thermometer. It's because our hands are not reliable. So the fact that you feel your hands on your body, and the child is warm, does not mean the child has fever. Please use your digital thermometer. It will write the temperature for you, and if it's 37.4 and less, it is still normal. Please don't give paracetamol. Please don't treat malaria. It is only if it's above And even if it's above, give paracetamol. Don't treat malaria. If it is continue for more than 24 hours, even some people say 48 hours, then go and see the doctor. Or if within that 24 hours it's very high, like it's going to 39, going to 40, please give paracetamol, go and see a doctor. But if it is lower, like less than 38, you can still watch it for 1 or 2 days before you go and see the. But if it's very high, 39, 40, because child can convulse with high fever, then you need to see the doctor for treatment. Okay, I think let's take some of your Instagram because
Okay, ma.
Facebook is rising up
Sonia
again.
is asking again. I think we have answered some of her questions in our previous comment. So she's adding that my only challenge now is that he seems to be allergic to the medication or something else. He has some reaction on his face. Now we are trying to clear. Please, when you are sending your question, ensure you send them in one comment so that we will be able to follow up by sending them bit by bit. Some of the question might get lost.
But I think we've answered that question. Maybe I'm sure you have
Yes,
had our
yeah.
answer now. Yeah. Okay, there's a
My
question
own,
in
yeah.
the sorry, there's
Go now. Okay,
okay.
ma.
Sorry, there's a question in the question box because some people also use that box. I'm not sure whether you can see
Oh, okay,
that.
ma.
This
Okay, ma.
Anu Shay saying, please, what's the quickest way to get my
Okay,
baby to?
please, yes, I can see that, ma.
Okay,
What's the quickest way to get my baby to stop breastfeeding? Is a year and a half.
okay. So there's no quickest way. You stop breastfeeding. You stop breastfeeding. So in other words, you stop breastfeeding by just stopping breastfeeding. That's all. So, but what we normally recommend is that you do it as a gradual process. So in other words, you may first stop giving the daytime, morning and afternoon. You take it out. So the baby suck only at night. So it's better that way than for you to just stops everything bam. So it's possible to do it. We actually recommend that you breastfeed for 2 years, but you've tried 18 months. But if you want to go forward and be excellent, you can do 2 years. But if you want to stop at 18 months, gradually stop breastfeeding in the morning, then you can stop breastfeeding in the afternoon and then the night time. And the day you're ready to stop, you just stop and that's it. So, but just make sure your baby is already established on complementary feeding and all those other things, so that when you stop, your baby is eating on the food. Of course, the first few days, your baby is going to cry, but you have to make up your mind you're ready to stop. And of course, you may also have fullness of your breast. You have to wear firm bra. You can, yes, you can take painkillers, but don't be expressing the breast. You can put a warm compress to allow some of the milk to go and all that. But usually within 2 3 days it will go away. So you can read on our website. We have what we call
Yes,
simple
ma.
tips for winning. You can check it
Yes.
out
You can
and
also check on our Facebook page.
yeah.
Yeah. So the same Lumina again is also purging and retrenched back to purely breast milk due to the illness and is eating the semi-solid. I currently give the SMA Gold for 6 plus and freeze to go. Could it be the food?
No, phenomena, your child is sick. So if a child is sick, a child will have all those symptoms. It has nothing to do with the food. You already told us your child was sick. You've been to the hospital. You've done a blood test. The white blood cell is 14,000. That means the child has infection. So the child is ill. So let the child complete the treatment that the doctor has given to you. So and then you can even go back to your doctor for follow up. So this is not the time to be blame me food, blame me anything else. So a child who is sick is sick. So I'm sure your doctor may be able to answer why the child is sick. I don't know, but from what you've told us, your child is ill. So I think, well, this time is for you to just wait for the child to get better, and then you can now go back to feeding, to do all the other things. And so all those symptoms like purging, fever, vomiting, rashes, they are all still part of that infection process that the child has. A child who has infection can have symptoms in any organ, because infection means there's some germs that is circulating in the blood, and that is what is causing those symptoms. And I guess your doctor must have prescribed antibiotics or treatment for that. So let it finish working. If you think the child is not getting better, or you think the drug is not working, or the child is reacting to drug, you have to go back to the hospital, see the doctor. They can either stop the drug and give you an alternative, but we have for treats that infection, and after finishing treating that infection, then that is when you can now wait for the child to recover, and then the appetite to come back, every other thing else will come back, the diarrhea will stop, and now it's a gradual process. Unfortunately, you can't. Some parents, sometimes when you go to the hospital and the doctor give you drugs, you expect everything to, after one dose, for everything to go away. It doesn't work that way.
Like a miracle.
We are not miracle workers. We are doctors. So in other words, things take time. It took time for that infection to get to that level. It's also going to
Yeah.
take time for the bacteria or the whatever germ is there to
Mm.
get cleared off. So I always say parents, don't worry if you have just started treatment, and because people will tell me I went to the hospital in the morning and I given the drug, and they are telling me in the evening, but the fever has not gone. The fever is not going to go in one day. So just relax. You've only given one dose of the drug. It's not going to disappear. Just continue with the treatment. Usually, I always say after like 48 hours, 72 hours, and there's no improvement, then you can come back to see your doctor and we can review. But don't expect everything to disappear immediately. Unless it's getting worse, then you can go back immediately. But if it is not getting worse, but it's still there, just give the drug time to work. The drugs have to be absorbed into the blood. They have to go into all the different parts of the body. And one dose is, that's why we give drugs for 5 days. We give it for 7 days, because we know that one day is not going to do all the. If not, would have just given you for
Yeah.
1 day and tell you not to worry again. Yeah, so that is why. So just be patient. I know it can be very frustrating when you have a sick child.
Just less than 5 minutes more.
Yeah, we will try and answer all the questions that has come in before sex, and after that, the rest will, unfortunately, you have to post it on our Facebook
Okay.
group.
So
So,
good evening, ma. My baby was born on the 12th of February 2021 at 2 kg. Then she had jaundice and dropped to 1.5. Wow. No question. Just
so what's the question? Are you
there's no
worried about
question
the
here.
weight? Don't worry about the weight. Your baby
Oh,
is
okay.
your.
As of today, I think I can see it. As of today, she is 1.6 kg, which
Yeah.
is 13 weeks and 3 day post birth. Because of her weight, she can't take any immunization.
Mm,
Kindly advise what I do to make her add weight. She's been
mm.
taking a one as I'm not lactating.
It's a complex case. Anyway,
That's
you should be seeing a pediatrician. Actually, you should be seeing a pediatrician, because your baby, I would want your baby to be on breastfeeding. I want your baby to be on breast milk. But you're doing none. It's okay. But so as long as you're breastfeeding or you're giving the food, baby will gain weight. It's going to be a gradual process. But did you say the baby is 13 days or 13 weeks?
30 weeks now. 30 weeks
And it's
now.
still 1.6 or 1.8?
Yes,
No, that
1.6.
1.6. No, baby cannot be 13 weeks.
Yes,
The baby was born in 12th of February. Now today is March. Today is
yes, ma'am.
March 8th. So baby I think she meant 13 days. No, not 13 days, but at least maybe it's about 3 weeks, 3 weeks or so.
It's about 3 weeks now. Yes.
Okay, 3 weeks is not so bad. Just give it some time. Just keep feeding the baby. I would have been more alarmed if it is 13 weeks, it's like 3 months after. No, I would have been more alarmed. But if it is 3 weeks, no problem. Just keep feeding the baby. Please put that baby to the breast. Your baby needs to suck, but express the milk. Express, don't feed directly all the time. You should still be putting the baby to the breast maybe once or twice in a day, but express the milk, because your baby need breast milk for infection purpose, prevention purposes. So it's very, very important. Put the baby to the breast, but express and feed with cup and spoon. You understand? And make sure your doctors have seen your child. You didn't tell her whether your baby was born premature, because why was baby 2 kilos? We didn't get that information, because I need that information as well. So is it a preterm baby, or is it a baby that was already term but was small for gestational age? There are two
The
different
baby was born on the 12th of
but
February.
she didn't tell us the age
You
of the
have to know.
pregnancy. You didn't tell us the age
Yeah.
of the pregnancy. So that's important. Anyway, don't worry, just keep feeding the baby. I personally
I'm
would
seeing
want to be
Tomalara. Okay.
I personally want
Okay,
that baby to be
continue,
on
ma'am.
breast milk. But I don't know how you're going to do it. Mm.
Yeah. Yeah.
For so many
Ma'am,
reasons.
does taking the pin and abdomen after 3 weeks of delivery affect my baby?
Well, your doctors would have told, your doctors are where you are breastfeeding, are they not? So, because your baby has, I guess you have hypertension and you have to be on medication. So adult meds is okay. I'm not so sure of nifedipine. I need to check that about breastfeeding. So read about breastfeeding and read the leaflets of the nifedipine and its use in breastfeeding mothers. But I guess your doctors should know that. And if they say it's okay for you to use it and to breastfeed with it, that's fine. No problem. I
Mama
need to
Hazel,
check
is
that.
there any reason why children in the Western world are more allergic to peanuts than children in Africa?
I don't know. I don't know. I don't have answer to that question. But I think people are also allergic in Africa. I don't know, but maybe we are not so
Yes.
common. And I think exposure has to do with it. There's been a lot of debates in science about whether we should actually introduce the children to these allergens gradually and let them get used to it, or whether we should just let them be. But I just know, yeah, you are right in that observation. But to be honest, I'm not so sure why. I don't know why. I think people generally in the
So,
West have more allergies than we do in the South. I don't know. Maybe it's genetic. I don't know why. Yeah.
so Omolara is adding to our question. Please, sometimes when my baby is sucking, she tends to be restless. What can be the cause? And when I'm breastfeeding, I used to scratch my body. What do I do?
So I don't know why your baby is restless. Number one, are you attaching the baby to the breast properly? Making sure the baby is sucking on you make sure that you are watching that you are not blocking the baby's nose with your breast. So breastfeeding is a very active process. You don't just shook the nipple in the mouth of the baby and be looking elsewhere. You have to be looking, make sure that you're properly attaching the baby to the breast, and that the for those women who have big breasts, that your breast is not blocking the nose of the baby. So usually that's why sometimes you have to put your hands, on top around the areola, so that there's this gap in between the milk. I mean, in between the nose and the breast. That's number one. So if there's no attachment issue, the only other thing that can also cause that is a baby who has some abnormal connection between the airway and the milk way. So normally the airway is in front of the food way. So, but sometimes in some babies they have some what we call like tracheoesophageal fistula, like a kind of abnormal connection between the two. And so now those babies they start to choke when they're being breastfed. But usually your doctors would have picked up that as well, because usually you see the baby choking and all that, and it will happen all the time. So you need to check all this. If you are not sure which one is causing it, it's better you let a pediatrician watch you breastfeed your baby. And then, but usually the commonest reason sometimes is when we're not properly attaching the baby to the breast and we're not watching, and the breast is falling on the nose of the baby and is choking the baby, and the baby is not able to breathe. So baby is not breathing, then baby will be restless. So make sure you are not blocking the nose with the breast. So if you are doing all that and you're still not sure, your baby is very restless, then you have to see a pediatrician to see you breastfeed and to be able to help you with that.
Okay. Thank you, ma'am. Please, can I quickly add this? Please, Omolara, if you are a first-time mom, we have a course for that. Please, we have a course for that. And for everyone that are first-time mom, we have a course for that. You can make your inquiry on our Facebook page. All these questions, our pediatricians are going to be there to nurture you, to help you out throughout your the first 1 year. Am I right? The first 1 year, Dr. Baby.
For what? Is it for the breastfeeding?
First-time mom. Yes.
Okay, you mean the first time mom? Yeah. We also have a course for first time mom, but we also have a breastfeeding course as well, which is free, which you can watch all the videos.
First-time mom is not free.
Yeah, that one is not free.
Okay, yes. So they can actually subscribe to it because it will ease them from all this stress.
Yeah.
They
If you're
won't have to
interested,
worry.
just ask on our Facebook group, then we can do that. Okay, I think we need to rush now. Our time is up. So, do you have any questions? Do you see have on Instagram?
Please, Doctor, do you have a question from your side?
I have a lot from my side, though.
Oh, okay. I think we should just go back to your side.
Okay. You don't think okay. I think you should finish Instagram, then I go to Facebook and run it up from there.
Oh, okay, ma'am. Please, doctor, my baby of 2 months plus do cough and stop. What can I use for him?
Not saying don't use anything for him. Most cough in newborn babies or at this age is usually viral infection. So what I normally say, exclusively breastfeed your baby, keep your baby warm. That's all you need to do, and the cough will stop. But if your baby is having fever, if your baby is having difficulty with breathing, or baby is becoming very breathless, you have to take the baby to see a pediatrician. That's all you need to do.
Philomena, please, your questions has been answered. Your child has been healed. Just be patient and follow doctor's prescription.
Yeah. Yeah, I think
Angela,
she's just
thank
giving us
you.
information. She's just giving us information.
Oh, okay. Oh, because she said I had allergies when I was
Yeah, she's
pregnant
just
for 2 years,
updating us. She's
and
just
stomach
updating
now
us.
affects breathing.
Yeah.
But the doctor have said to just monitor. He should go
Uh,
away on his own.
yeah,
That's
so
true.
just follow your doctor's advice. Yes.
So I think okay, we have one more. Chief, good evening, doctor. My son has a signs of autism at 2 years
Mm.
old, and he's almost 4 years old now. And those symptoms are gone. Do I need to still take him to neurologist for evaluation?
I think it depends on you. Was the child given a diagnosis? Because you said the child has symptoms, but you didn't tell whether we actually give a diagnosis or not. Usually, generally speaking, we don't take back the diagnosis of autism. Of course, the child can overcome the symptoms with therapies and all that, but we don't usually take back a diagnosis. Once we diagnose autism, it's a lifetime diagnosis. But if your child was not given a diagnosis before and you were just thinking there were some symptoms and you want to still be sure, you can then see a neurodevelopmental pediatrician for assessment if you want to have an assessment. But if you're not worried, but it's really up to you, really. It's up to you what you want to do. But if you are worried, I think you may want to let the professional see your child and either tell you there's no diagnosis or there is diagnosis. So it's up to you. Yeah.
Yeah. So for care in the America, the doctor said I can start giving my baby fresh cow milk
Mm,
once she clocks a year right now.
mm,
Once she crosses a year, right
mm,
now she's 11 months old and
mm.
has no teeth. Crawling is yet to be perfected and doesn't stand yet. She was EBS.
What is EBS? You have to tell us EBS so that we are sure we're on the same
Because I
page.
don't know.
Okay, so you can
Um,
give your. I don't know what your question is really. So your maybe is what is your question? Because you have not asked a question. You've only given us information. So what you said about cow's milk is okay. It's correct. It's at 1 year you
okay,
can
I
start
think
cow
her
milk.
question is, as the taking breast milk, I don't know how to transit. I mean, the transmission. I don't know how to
There's no
transition.
transition. You can keep giving both. You can give if you are not ready to stop breastfeeding, keep breastfeeding. The fact that you are giving breastfeeding, you are still breastfeeding does not mean you cannot give cow milk or formula and all that. You can give it. Your baby should be on complementary feeding. I hope it's not only breastfeeding you are still doing at 1 year. I hope not.
Okay.
So your baby should have been
She
eating
said,
other food by
yeah.
now.
She said, oh, she likes start with age appropriate milk. Never had formula. So I
You
think she has been doing it here.
but you are giving other food. I hope it's only EBF you are doing for 1 year. That would have been that's not right. Anyway, to answer your question about cow milk formula, it's up to you. You can choose one. I personally would recommend you give age appropriate formula. In other words, give the follow up toddler milk. Because the reason why I normally recommend that is that there are other things they've added to the to the follow on formula also cow milk, to be honest with you. They only added other things to it. So instead of so it's the same, it's just the same cow milk, but this time around they've taken it to the factory and they've added some vitamins, they've added some DHA, they've added a few things to it. So that's just the difference. Whether it's formula or whether it's fresh cow milk, all of them are still cow milk. But the only difference is that if it is the one that has been processed in the by the milk manufacturers for babies, they've added a few more things to it. But those things they've added to it, you can also get it for your baby through other food. So your baby is eating all that complementary food. They're going to get their vitamins. They're going to get it from fruit, their vegetables. So it is really there's no hard and fast rule. I just say do whatever works for you, really. But if you are not sure your baby is going to eat the fruits and the vegetables, so you may be on the safer side giving a follow-on milk because that follow-on formula has those other things so already added to it in the industry when they're making them. That's just the only difference. They're all cow milk. Okay.
Ukona Hazley, are boys more at risk of delayed speech than girls?
No, I don't really think so. But generally, boys are usually at risk of more of the developmental issues than girls, generally speaking. Generally speaking. But there's no particular thing about boys and delayed speech. But I guess people say girls talk more than boys. Not necessarily that they are delayed. That is different from delay now, but girls generally talk more than boys. But when but does not mean that they
I've
are
never
delayed.
observed that.
Yes, but there's really no hard there's no scientific reason to say boys are more delayed than girls when it comes to speech. On in normal children, no. But when we talk about children who has developmental issues, boys are more affected. Yeah.
Animal Sharon Oko, my 1 month old baby passes through at each feeding.
Yeah.
Please, ma, what can I do?
There's nothing to
Also,
do.
the
It's
stool
not
is yellow
abnormal.
in color and watery and sometimes has mucus.
Okay, there's nothing abnormal about a baby passing stool after each feeding. It's a perfectly normal phenomenon. There's nothing wrong with that. So, and your baby's stool at 1 year, 1 month is not going to be solid stool. So it's going to be a mixture of some watery stool and some solid part. So as long as the stool is not like complete, like urine completely sinking into the diaper, it is not diarrhea. That is normal stool for the baby. Now, the mucus part could be what you are giving the baby. So you didn't tell her whether your baby is on exclusive breastfeeding or your baby is on formula. Are you giving drugs? So there are, because mucus is from the lining of the intestine. So there are some things you may be giving the baby, or you are also taking yourself, that can affect the baby's stool, or those kind of things. So you just pay attention to it. I actually, the commonest thing from my own experience is some of our multivitamins that we give. So most of the time they make, but there's nothing to worry about. It doesn't it's not a problem. It's not something you have to deal with. I worry if there's blood in the stool. I will worry if the stool is like completely like water, like urine, you can't see anything on top, or the stool is
Or
greenish. And
yeah.
those are the things that worry me. But every other thing else you said, there's absolutely nothing wrong with that, and there's no need to
Yeah.
worry about it.
Shop Mart Nigeria. I just put to bed. My baby is like
Congratulations.
2 weeks plus. But one of my baby breasts is still kind of hard
Mhm.
than the other, a baby boy.
Mhm.
Any cause for alarm?
No cause for alarm. Please don't press it. Just leave it alone. It is not abnormal for baby's breast to be enlarged, because it's the same hormone that was in your blood as a mother that make your breast to enlarge for breastfeeding. Part of that hormones goes into the blood of the baby, and that is what is causing that enlarged breast in the baby. But within a few days, the hormone will be cleared off. Whether it's a baby boy or baby girl, doesn't matter. The same hormone that is affecting it. So it's a natural response to the maternal hormones, which after a few days will clear, and within a few months it will clear. But please don't press it, don't massage it, don't do nothing, because that is where the problem is. It is your massaging and pressing it that is going to get it to get infected, and it's become that's when we now start having infections, abscess, and all that, which is not the problem. Just leave it on its own; it's going to go away. So there's nothing to do
Yes.
anything to it.
Don't
So
massage, please. Don't massage. Just
don't
leave it.
massage
And
you.
Cadre food says, please, can 1 year old baby take complan milk?
No, we don't want complant milk for babies. Please just give them the regular milk. There's no reason. You didn't ask this question about check can a newborn travel by air locally? A newborn baby can
Yes,
travel.
yes. We've
they,
not
they can
answered
travel,
that question.
but it's better to avoid traveling if you can. But it's not as if they can't. But just make sure just keep breastfeeding your baby and all that. That's what you need to do. But it's better not to subject babies to all those early travels and all that if you can
Yeah.
avoid it. But nothing will happen to them if they travel. Okay, I think we are
I
done.
think we have the last question. The last question.
Finally.
Awedini, my second man, one of my twin who is 2 years and 7 months coughed a lot. When taken to the hospital, I was told his chest is clear, but yet he still cough. What could be the cause, ma'am?
So the doctors that saw your baby should be the one to answer that question, because they examined the baby, they must have asked you a question. So if I have to tell you what's the cause, I need to ask you a lot of questions all over again, which we can't do online. So there are many reasons why the child could be coughing. So a chest infection is one of them. Maybe that's what the doctor meant by the chest is clear. But The chest is clear does not mean the child cannot have upper respiratory tract infection. What the doctor is telling you by the chest is clear is that there's no lower respiratory tract infection, but upper respiratory tract infection can make a child to cough. If the child have fever, if the child having fast breathing, there are other information we need to ask. Is it allergy? The child could be allergic to something. The child could be asthmatic. There are many other things that will make a child to cough. But so these are the kind of questions your doctor should be able to answer based on the information they've asked you, which unfortunately you have not told us now. So it's difficult for us to be the one to tell you what the child. But the only thing I can tell you from what you've told me is that if your doctor tells you that the chest is clear, it means the lower respiratory tract is clear of infection, but does not tell us what is happening to the upper respiratory tract. It does not tell us whether the child has a problem in the heart, which can also cause cough. It does not tell us whether a child has asthma. It does not tell us so many other things. So if your child is still coughing, you need to go back to the doctors and ask that question so that they can do more tests. Sometimes we need to do chest x-ray, we need to do other things before we know why the child is still coughing. Okay?
Yeah. Please, can we ask one more question?
Okay.
Okay. Tender for Chris says, what can I give to a child growing teeth to stop the fever?
Not yeah. If a child is having fever, give paracetamol. That's all.
Yes.
There's nothing else to
Ensure
give.
check the temperature with thermometer. We have been measuring that since.
Yeah.
Ensure you check. Don't use your hand to detect whether the child is having fever or not.
Yeah, and then somebody is asking about Cradle Cap and all that. And yeah, if your doctor has prescribed something and it's not better, then you need to go back for follow-up. Obviously, you've seen a doctor, they've written some medication. The diagnosis may be wrong because normally even for Cradle Cap, the treatment is just for you to wash the hair with shampoo, baby hair shampoo. That's all. And then you comb it out. So I don't know why maybe it's getting triple time, it's getting Sincoside, it's getting augmentin for the same thing. It's either we're not talking about the same thing or we are something is wrong somewhere. So if you want to ask that question, you can post it on our group and show us a picture. Then we can tell you whether it's actually a Cradle Cap or something else. Because Cradle Cap does not even need all this long treatment that you are giving. So unless there's something else, and a lie is not Cradle Cap, so there's a lot of confusion in that question. So that's why so I would rather say just post the question on our group and then we can take it up from there. All right. Okay, I think we've answered all the questions. I just want to make sure we didn't leave out anybody's question. Okay, let's quickly finish the one on Facebook, on Facebook. Okay, I think some questions are double. My one multi-part tool I teach feeding. Please, what can I do? Nothing. Don't do nothing. It's perfectly normal. Okay, I think I jumped one question. Oh, I've jumped some people's question. Sorry. Okay, no, let me go back to the questions. Okay. Princess, okay, I've answered this one. Okay. Peace Peters, I've answered this one. Okay. Okay, yes. Okay, I think I've answered this one. Okay. Jam, yes, this is one I missed. Okay, we said complimentary feeding last month. She takes lots of water. The poo is still very hard. So what are you giving as complementary feeding? You need to give fruits, you need to give vegetables. So if you're only giving cereals as complementary feeding and milk, this too will be hard. So it's not only just the cereals and the milk and water, you need to give fruits, you need to give vegetables. So try and have those ones. And if you do all that and the stools are still hard, then you need to see a pediatrician. Okay, so Amina is asking, is it normal for a 2-month-old baby to sweat when breastfeeding? Yes. So sucking is walk. So the same way you sweat when you are walking, it's the same way baby sweats. And some of you don't help matters because you also will dress them so tight, wrap them and everything, socks, caps, mittens. They will sweat definitely. So there's nothing wrong with baby sweating when sucking. It's the only walk that baby does. So that's fine. So what causes throat infection? Throat infection is caused by germs, bacteria. Sometimes it can even be caused by other things like viruses as well. So it's infection. So when we say infection, we need something caused by germs, and there are different kind of germs. So we have the viruses, we have the bacteria, we have fungi, we have different types. Of course, the commonest one is bacteria. And so the remedy is the treatment with the appropriate anti-infective agents. So whether if it's bacteria, we'll give antibiotics. If it's virus, you don't need any treatment. If it's fungal, we'll give antifungal. So what that means is that you can't assume how to treat throat infection. If you think a child has throat infection, you need to see a doctor who will examine the child and prescribe. Please don't abuse antibiotics. Don't use it without a prescription of a doctor. I hope that's helpful. Ayomide is saying my baby of 8 weeks almost want to suck even when his stomach is full. What can I do, please? Sorry about that, but baby just like sucking. So sucking is not just about feeding. That's what I always say. Some other mothers who say, oh, my baby is not full. So your baby can be full and still want to suck. It's a pleasurable thing to suck, and
Yeah.
it's a fun thing for them, and it's also a way of bonding with you. It's a way of feeling close to you. So it is what we call non-nutritive sucking. They just want to suck. So you can what you need to do is, if you know your baby is full, just remove the baby from the breast and find other way of rocking the baby or petting the baby without necessarily putting the baby to the breast. The fact that baby wants to suck does not mean you have to put the baby to the breast all the time. You are still the mom, and nothing will happen if you don't put the baby to the breast. When you know the baby is full and baby, so you just find a way of keeping the baby warm to you and all that. And after a while, baby will get that information. We don't encourage pacifiers and all that because it can cause nipple confusion, which is what some
Yeah.
people also do, but we don't encourage it. And then the rate of germs dropping on the floor and all that's another issue entirely. So we don't want that. Okay. Tosi is saying, how can I get a speech therapist? So if you send us a message on ATP, we will link you with one of our speech therapists, and we can recommend, depending on where you are. If you're in Nigeria, we can support you. Even some of our speech therapists also do virtual consultation and support. So just send us a message on the group, and somebody will send you the link on how to book an appointment, or you can even book it on our website as well. Okay, Thompson says, is it okay to give babies bottle fruits puree, or will you advise we blend the fruits ourselves? Okay, so yes, I prefer you make it yourself. I prefer you make your fruits fresh from your own kitchen, puree it and all
Yes.
that. Is cleaner, is
The best.
safer, it doesn't require any preservatives, unlike the one you are buying in the stores that will have to be preserved somehow. So it's fresh and direct. So make it yourself is actually better. All right. Ibukumi say, yeah, I think I've answered your question, Ibukumi. There's nothing wrong with your baby 1 month old passing through at each feeding. It's a perfectly
Yes, they are
normal
bastard.
reflex. So it does not mean the baby is passing out the milk, the baby is just sucking. It's a stool that has been stored before. But the baby sucked, it's a reflex that relaxes the intestine and the rectum where the stools are stored. And so the baby passes through. It can affect adults as well, but just the adult you can control it and decide out I'm not going to go now. So, but it's a perfectly normal reflex, so there's no reason for you to worry about it. Okay. So Makinde is saying, what can make a baby's pool to be drawing like mucus? It's yellow in color. So when you're asking this kind of question, you need to tell us the age of the baby. You need to tell us what you're feeding the baby, because this question is hanging. We don't know which age group you are referring to, so we don't know um how to answer that question. So if you say your baby has mucoid stool and you say your baby's stool is also sinking, it's upper, so that may sound like diarrhea, like it's sinking completely. You can't see anything on the top. That may be a child who is having diarrhea. Now you don't have to tell us the age of the child. You need to tell us what the baby is feeding on. Then we can now advise you on what to do. Okay, Rejoice say my baby has temperature, she's vomiting, she's stooling. What drugs have you given her? Because when the baby is vomiting and stooling, you need to give ORS. You need to give oral zinc. Baby is having temperature, you can give paracetamol. Then you need to take baby to the hospital so that we will know why the child is having these symptoms. The child is is ill. A child who is having fever, vomiting, and there. Because the reason why I really want to go to hospital is because a child who is vomiting may not be able to even take ORS because the child may be vomiting it as well. So that child
Yes.
needs to be given rehydration through the veins by drip, that according to what people call drip. So that child needs to go to hospital. So it's not enough for you to worry. You need to go to the hospital so that a doctor can see the child properly. Okay, listen, me. Thank you for joining us. Good evening. Marking Day is asking question. Okay, finally you've given us the information. Like your baby is EB health and it's 2 months, and okay. So your baby is on breast milk and your baby is passing watery stool, very very rare. So you need to pay attention to, are you taking any drug, are you giving your baby drugs, because those are the kind of things that will affect the baby's stool. Are you giving any agbo, are you giving any other thing to the baby or yourself, or is there anything you are taking that could be passing via the breast milk to the baby? So that's why. So don't give the ORS. A 2 weeks old, 2 months old don't need ORS, don't need oral sync. Keep breastfeeding exclusively, but pay attention to what other things are you giving this baby. So if you are giving antibiotics, if you are giving drugs, that may be the reason why the child is having those mucoid wateries too. And the solution is for you to stop those things, and baby stool will go back to normal. Or if you are taking any yourself, if you are breastfeeding, you need to always let your doctor know you are breastfeeding, so that whenever they are giving you drugs, they are conscious of it, so that they know the kind of drugs you should not take as a breastfeeding mother and the one you should take as a breastfeeding mother. Okay, so Favor is asking, what can I use to clean my baby's nose and hair for dirt? You don't need to clean your baby's hair for any dirt. The hair clean itself.
Yes.
So usually it will bring it out as wax, and you can just use like a soft handkerchief, roll up into a point, and just clean it out. That's all. The same thing for the nose. Please don't use cotton bud. Don't put it into their ears or into their nose, because it can cause
Yeah.
damage to the some of their to
Head
the
drums.
eardrum and the nose as well. So one of my breasts is small, and my baby cannot take it. No, there's no breast that is too small for the baby to take, because what the baby needs to suck is not the breast. What the baby needs to suck actually is just that black thing behind, beyond the nipple, what we call the areola. That's all the baby needs. The baby doesn't need the whole breast. Whether your breast is big or whether your breast is small, it doesn't matter. All those ones are fats. What the baby is needing is just the milk, and the milk dots, or what we call the sinuses or the bank, they are stored behind those black parts beyond the nipple. So those are the only part that is relevant for your baby to suck. So, and it doesn't matter whether it's a big breast or it's a small breast, it's still the same. In fact, people who have big breasts have to struggle to make sure that their breast is not falling on the nose and blocking the nose of the baby. So it's not by size. So don't be worried, don't be scared at all. The only people that may struggle is if the nipple itself is not coming out. That is what we call retractile nipple. And there are ways for the nurses, they know how to help you to kind of bring it out. Usually we encourage you to start doing it even before you deliver the baby. So, but if your nipple is inside, not shooting out, but it's on the inside, then you can see any of our midwives or nurses, they will teach you how to bring it out. And then you can also express the milk as well. But the size of your breast, honestly, is irrelevant when it comes to breastfeeding, because all the baby needs is that nipple and the areola. That is where all the milk action is. So I hope that is helpful. And you should please breastfeed with both breasts. Some mothers always like to do one breast at it. No, please. There's a reason why you have two of them. Alternate the breast. Make sure you give both breasts. And when you finish feeding one, the next time you change to the next one is very important. Can the food I eat constipate my baby of 6 months? No, the food you eat is not going to make your baby constipated. The food your baby eats is what's going to make baby constipated. But please give your baby water, give your baby fruits, give your baby vegetables. Don't just be giving only cereal and milk. Make sure your 6 month old is taking water, is taking other food that are high in fiber, actually the vegetables, fruits, and all that. So, but what you eat is not going to cause any constipation for your baby. And constipation, while we are on that, is not the fact that the baby doesn't pass through every day, because some mothers think if your baby doesn't pass through every day, that's constipation. No, that's not constipation. Constipation means baby is passing hard stools. So if your baby doesn't pass through for 1 week, because a 6 month old is still taking mostly breast milk, but whenever the baby is going to pass the stool is going to be normal soft
Hard.
stool, then that is not constipation. But if the stool is hard, then that is constipation. I always like to clarify that, because I found that most mothers understanding of constipation is different from our own understanding, so we need to clarify that. um my 4 year old is weighing 27 kilos to 30 kilos. Is it too much? Yes, it's too much. A 4 year old should be weighing averagely 16 kilos. Yeah, So if your 4-year-old is weighing almost double that, I will worry about that. So you need to see one of our pediatricians. Usually with the pediatric endocrinologists, especially, they are the one. They need to know why. Sometimes it's just food and all that, but sometimes there's some medical condition that is making a baby to be very big, unless you are really big in the family and all that. But even then, I'm worried at this age if a 4-year-old is weighing this much. So we need to see how to help the baby, cut down the food, activity, increase activity, then check that there's no medical condition that is making the baby to add weight that much. Good evening, Osinachi. Thank you for joining us. Isa, thank you. How do you treat rashes? So rashes, as I've said, there are different type of rashes. Some rashes are like in your 5 weeks old baby. Some rashes are actually normal in them. So we need to see the rash first. So post a picture on our Facebook group of the rash, and then we'll advise whether it's something you don't need to do anything about, or whether it's something that you need to do anything about. The last point is saying 4-year-old that is coughing when he took candy. Why? It may be allergic to something in the candy, or it may be choking on the candy. So please stop giving the candy. That's a very straightforward. Since you already know what's normally made the child to cough, just stop it, and that will be the end of it. Okay, I think that's the last question. What can I use for my baby with constipation? You didn't tell us the age of your baby, but a child with constipation, generally speaking, I hope your baby above 6 months old. So give water, give fruits, and give vegetables. Those are the kind of things you can do for the baby. Uh, is this session working? Okay, it's working. Okay.
Yes.
Um,
Uh,
okay, do you want to read that, Somalara?
yeah, I haven't seen it from here.
Okay, so I said the pediatrician told me not to give my baby food in my kitchen because her system is not yet developed. Is it the Funke that is asking question about formula and 1-year-old and all that?
Yes, how to transit. We have already
So
answered
are
that
you
one
saying your
before.
baby is not taking any other food apart from milk, breast milk? That is wrong, oh. I hope you didn't misunderstood your pediatrician. Usually from 6 months old, you should start giving them complementary food.
Complimentary.
So your baby cannot be on milk for exclusive breastfeeding for 1 year. That is absolutely
No.
wrong. Your baby should be eating other food from 6 months, if that's the question you are asking us. So that is really not acceptable. Okay, I think we've answered all our questions, and I'm sure there may be some question on the watch
Yeah.
party, but I hope our moderators moved it. I don't know if they didn't move it.
Uh,
Unfortunately, we have time is gone.
we have
Um,
tried.
we
We've
won't be able to
exceeded
answer.
our time already.
Yes, we've gone extra half hour. Thank you so much for
Yes.
watching. Thank you, Abimbola, for staying with me. And thank you so much for those
Thank
who
you
have
for
watched.
having me.
Thank you so much for those who have watched. Yeah, Thompson, we've answered your question. Yes, the answer we gave is correct, whether it's 10 months
Yeah.
old or yeah. So thank you so much, everyone, for watching. So this program has been brought to you by Ask Pediatricians Foundation. And then once again, we wish all of you happy International Women's Day. We are a women predominated group, and we also tend to support women mostly. 75% of our members are women. Thank you so much for taking care of our babies. And like we said, in ATP, we choose to challenge the deaths or preventable deaths of children, and by giving you this kind of health information, education, and of course, we do outreaches as well. And we welcome all your support in challenging these health issues of our children. So ATP Live comes to you every Monday at 6 p.m. On all our social media platforms, Facebook, Instagram, YouTube channel, and you can ask all your questions. And sometimes we also have special guests that we bring in. If you want to see any of our pediatricians, you can make inquiry on any of our platforms, and we will arrange for you to see them in ATP clinics. But if you have other questions that we've not answered, no problem. You can go to our Facebook group and you can post your questions there from Mondays to Saturdays. If you don't want your
Yes.
name to appear, we have an option for you to post your question anonymous,
Anonymous.
anonymously without your name showing. So till we come again your way, same time on Monday, it's bye from me and Amalara.
So thank you everybody for joining us. Before I go, please, you can be our partner. Our account number is on our Facebook page, likewise on our website. You can support us with as little as 1,000 naira. We are preparing to go for our outreach by May. We want to support schools and children in Nigeria and in Ghana. Please.
Okay, Abolara is gone.
Hold on.
Okay, are you there?
Yes, I'm still here, ma. Okay. Thank you for having us, everybody. See you next week.
Okay, thank you so much. Our time is gone. I can see somebody say we didn't answer your question. Your question is late. This program is 6 to 7. So, but feel free to post your question on our Facebook group, Ask the Pediatricians. You can mix it on Facebook. It's one of the largest parents group on Facebook. So post your question in our Facebook group and one of our moderators will answer your question. Thank you so much, and we will see you next week. Bye.
Thank you, Dr. Baby.
I
Bye.
can't see you again, Amolara. What happened to you?
I'll see you.
Okay, bye. Bye bye.